Myself, I am Dr. Sishir Gang. I am a nephrologist and I'm a department chair at the Division of Nephrology, Muljive Patel Urological Hospital. This hospital is located in Nadia, which lies between Ahmedabad and Baroda. And we are a kidney-specific hospital. That means that we deal with kidney disorders. And we both have nephrology and urology services. This hospital has been engaged in kidney transplantation since 1978. Until now, we have done more than 3,000 kidney transplants. And every year we do about more than 150 kidney transplants. It's about 3 to 4 kidney transplants a week. Today, I will give you something about an overview of what the transplantation, who are suitable candidates for transplant, what is something brief about the process of transplantation, and something about the post-transplant follow-up. Essentially, when the kidneys don't work, there are two types of kidney failure. One is what is known as an acute kidney failure or a temporary kidney failure. And two, what is known as a chronic kidney disease or a permanent kidney failure. The transplantation is considered only in patients who have a permanent kidney failure or what is known as a chronic kidney disease when there is no opportunity of any improvement. Usually, once the kidney function goes below 10%, that is a need for dialysis arises. That's the point when a kidney transplant is usually done. So again, not all patients are suitable for a kidney transplant because when transplantation involves an implanting a kidney from another individual, the person who is receiving the kidney should be in reasonably good health, except for the kidney problem. So his heart, liver, brain, and other functions should be suitably good. If they are good, then they can be considered for kidney transplant. Usually, age is not a limiting factor, but patients who are beyond 65 years of age, we would usually do a thorough evaluation and then consider them for kidney transplantation. So that is what we call as the characteristics of who can receive a kidney transplant. Once it is decided the person is fit for a kidney transplant, the second question arises that who can donate a kidney? Because the kidneys have to come from some human individual. So there are two sources of kidney donation. One is a family donation and what is known as a living kidney donation. And second is what is known as a deceased donor or a cadaveric donation. First, briefly, I'll tell you something about the living donation and then about the cadaveric donation. So in the living donation, the current law allows the family members, that is parents, grandparents, siblings, that is brothers and sisters, spouse, that is husband or wife, and children who are more than 18 or 20 years of age, they can be considered as a suitable donor. Distant relatives, after specific permissions from the government, can be considered kidney donation. Kidney donation is relatively safe. Patients who have donated kidney many years ago, and there's a very long experience about safety of kidney donation. Since 1950s, late 50s, the kidney donation there's been good experience globally and also within the country that this donation is safe. However, it does not mean that everybody is suitable to be a donor. A thorough evaluation is usually done, which entails a physical and tests which are supposed to be normal. Moreover, there are other compatibility tests done, that is for matching the kidney, whether the person is suitable to donate or not. Generally, the blood group donation or blood group matching is usually done. But now with modern technology, we could do transplant also across a different blood group. Earlier, a patient from a B group could not donate to A group. But now with new protocols and new methods, a B group patient can also donate to A group after undergoing specific treatment procedures. So this barrier, which was earlier a barrier, is now no longer a barrier. But there are, of course, other barriers also, which we need to surmount and clear them. So this is about the living donation. About the cadaveric donation, what is also known as a deceased donation, that is a person who has had a brainstem death. This brainstem death means that the person has suffered a severe brain injury. It can be either due to trauma or because of some intracerebral hemorrhage, or if that is a vessel in the brain has burst open. These patients, once they reach the hospital and their heart is still beating, they are put on a ventilator. And on a ventilator, after all the tests which are done, it is found that there is no opportunity of any recovery of the brain. Then they are declared as brainstem death. There are a number of tests which are done for them before they can be considered for brainstem donation. That is, a brainstem death has to be there, and then they can be considered for brainstem donation. So such patients can then be donated. The two kidneys are there. There's a heart and liver, and many organs can be harvested from these patients and can be implanted into suitable patients. So this is about what is known as cadaver donation or deceased donor kidneys or deceased donor solid organs. So this is about the donor-specific considerations. The third aspect which I would like to tell you something is how the transplant is usually performed. Usually the donor and the recipient surgery happens simultaneously. So one team operates onto the recipient, another team operates onto the donor. And once the donor kidney is removed, it is then implanted into the recipient kidney. After the implantation, depending upon the source of a kidney, living donation or deceased donation, the function can start sometimes almost immediately. And then for the initial 2 weeks or 10 days, usually the patient is kept in the hospital and then he is sent back home. Important note is that after transplantation, the success depends upon a lot of care which is to be taken in the perioperative period and also in the post-operative period. So in the perioperative period, we take care of the giving adequate fluids, adequate medication, making sure the wounds are healed very well. And in the post-operative period, again, the most important thing is about the immunosuppression. We must realize that when we implant any foreign organ into our body, our body tries to reject that organ because it's foreign to us. And we use a lot of medications which are very effective to prevent the rejection from happening. But these medications have to be taken lifelong. You can't really stop the medicines because at any stage you stop the medicine, the rejection can happen. But the dose of the medications, timing of the medications, and many other things are usually, depending upon the response, depending upon the drug levels, they may be altered by the kidney specialist or the nephrologist who is taking care of you. But important to note that these medications have to be taken lifelong. So you can't really skip or stop. And in case if you feel any complications or problems, they need to consult your doctor and they will suitably alter these medications. Generally, the care after the transplantation, usually after about 4 to 8 weeks, the patients are usually, they can go back to their routine activity. They can engage into all their family activities. They can go into the routine basic sports activity, professional activities, family life, everything. They can literally lead a good life. Important note is that because these patients are immunosuppressed, that is, they're more vulnerable to infections, and hence we tell them to take special care for that. The special care would mean that they need to possibly drink good quality of water, that is either a boiled water or good quality of filtered water they need to take. Avoid eating in places which are unreliable, so unhygienic food they should avoid. Otherwise, they can eat at home, and they can even eat outside after a couple of months of transplantation in a good restaurant where everything is good and hygienic. Regarding other activities, as I mentioned, that they can engage in all the routine activities that they like. But important note, they need a very, very stringent and regular follow. Another important thing is that should there develop any medical problem like vomiting, nausea, fever, pain at the site where the kidney has been implanted, they must consult a doctor immediately, because these patients not only would have routine problems that a normal individual encounters, but sometimes the problems can be very specific to transplant patients. Again, the infections which these patients get are sometimes much different from what the routine people get the infections, and therefore they need to consult a nephrologist or kidney specialist in their own town or to their own center where they're going to transplant. Because a delay in that would often lead to sometimes more severe complications. So as such, as I said, I have given you an overview about how a transplant process is considered, who can be suitable for a transplant process, how a donor is identified, what entails into the surgery, and what is the post-operative follow-up. I hope this overview would give you some information as to how kidney transplantation is done. And you must all realize it is a very, very life-saving procedure, and lakhs of people within the country and outside have undergone this procedure and have led a very good life. Important note again, at a caution, that in the long term, these kidneys can also undergo rejection, failure, or a complication, and they need to be addressed. Most important question most of the people would ask is that, what is the long-term outcome of the kidney transplantation? So generally, if you do 100 transplants and see at the end of 1 year, about 98 kidneys will be doing very well. 2 kidneys may have some rejection, may have some infection, or a surgical complication. At the end of 5 years, usually about 85 to 90% will be doing well. At the end of 10 years, about 70 to 80% will be doing well. And around 15 years, about 50% will be doing well. What happens to those whose kidneys fail? They can be considered for a second transplant, or they can go back to dialysis, or might be considered for 2 types of dialysis, that is hemodialysis or peritoneal dialysis. So a life after kidney failure, there have been significant progress has happened, and they can lead a reasonable good quality of life, and transplantation offers the best option when the kidneys fail permanently. I hope this small overview was good of help to you. Thank you.